Good day, I am Cristel May Bacleon from BSN 212K, and today I will be going to perform perineal flushing return demonstration. The purpose of this procedure are to remove normal perineal secretions and odors, to promote client comfort, and to prevent infection or contamination from the rectum. We perform perineal flushing to patients in labor and postpartum, comatose, diabetic, with indwelling catheter, and those with gynecological perineal repair. So prior to the procedure, we must ensure that the equipment we need is present to save time and effort. So the equipments we need are solution bottle and sterile water, container filled with warm water, clean gloves, basins. So I have here a kidney basin and a basin. Next is a 7 pieces dry cotton balls, 7 pieces cotton balls soaked in cleansing solution. Here it is. And a bedpan to receive rinse water. Newspaper to line and cover the bedpan, draw sheet, and also rubber sheet, forceps, and if necessary, a perineal pad. Next is to wash your hands or perform hand hygiene as universal precaution. We then explain the treatment to the patient. If not comatose, mentally or retarded, this is done to let the patient understand the procedure and gain the patient's cooperation. Good day, ma'am. I am Cristel May Bacleon, your student nurse from Davao Doctors College. So, today I will be assessing you in your perineal care. So, ma'am, may please state your name. Okay. So, your birth date. Okay, thank you. So, ma'am, I'm going to clean your perineal part. So, I will be exposing your private part. Will that be okay, ma'am? Okay, thank you, ma'am. This is done, ma'am, to promote hygienic care and to prevent infections or skin irritation in your private areas. If you may feel uncomfortable or uneasiness, feel free to tell me and feel free to say it. Okay? So now I'm going to perform the privacy for the patient. So I'm going to lock the door and close the curtains. So now, ma'am, can I proceed now? Okay, thank you. Okay, so it is really important to provide the client's privacy. So I have already locked the door and also closed the curtain. So next, I'm going to wear the gloves for infection control. So after I put my gloves on, we now position our patient on a dorsal recumbent. So for our patient to feel comfortable. So now, can you please lay down and spread your legs? Thank you. So now we drape the patient, exposing only the part to be cleansed because minimum exposure lessens the embarrassments and helps to provide warmth. So ma'am, I'm going to expose your private part. Will that be okay? So then, place a rubber sheet, draw sheet, and bedpan under the patient's buttocks. We do this to prevent the bed from becoming soiled. So, ma'am, can you please lift your buttocks area? Okay. So, after that, we inspect the perineum and then flush the perineal area with warm water. Note that the particular areas of inflammation, swelling, excessive discharge, or secretions from the surface, and presence of odor. And we use warm water to prevent chilling and softness of or dissolved blood clot. Ma'am, can you please check the warmness of the water? Okay, thank you. So now I'm going to pour a warm water to the patient's perineal part. After we flush the perineal part of the patient, we then get 7 pieces of cotton balls soaked in a cleansing solution using the forceps to maintain sterility. So, we then cleanses the external genitalia starting from the midline of symphysis pubis down to the anus. So, I'm going to start from the up down to the anus, then discharge. So then, second cotton ball cleanses starting from the mons pubis in figure of 7 by way of external labiums towards the anus. So, I'm going to get a cotton ball, and then away from me, I will I will cleanse the perineal part. So, discharge. Note that we won't be retracing the cotton ball again so that it will not cause any contamination to the patient. So next, I will get another cotton ball on the opposite side, and then discharge. And with the fourth cotton ball, cleanse this starting from the mons pubis in figure of 7 by way of internal labium towards the anus. And also the opposite side. With another cotton ball, cleanse the groin starting from the groin going up the thigh. Use another side of the same cotton ball for the near groin. After that, we flush the perineum thoroughly with the sterile warm water. After that, using dry cotton balls to dry the perineum with the same procedures and stroke I've done earlier. Starting from the midline, backwards. Discard. Now, remove the bedpan gently and turn the patient to the side. So, ma'am, can you please lift your buttocks so that I can remove the bedpan? Okay, thank you. So next, if necessary, take one cotton ball and clean one side of the buttocks. Then clean the other side of the buttocks and dry both buttocks to provide comfort. As if that I've already put the patient into her other side so that we can clean both buttocks. After that, spray with antiseptic as needed to promote healing. Then put the perineal pad with an up-down motion as needed to prevent contamination of vagina and urethra from anal area. So after we've done the aftercare of the materials used, then remove and discard gloves, and also perform hand hygiene. After that, we record the treatment done to the patient and any usual findings such as redness, exoration, skin breakdown, discharge, or drainage, and any localized areas tenderness. And also for documentation purposes, the procedure was done and means of communication. So that's the end of my return demonstration. Thank you.